Now we will look at aphasia to neurolinguistics. That is how it is central to the study of neurolinguistics. So neurolinguistics is the branch of linguistics that analyzes the language impairment that follow brain damage in terms of the principles of language structure and aphasia in an acquired language disorder subsequent to brain damage in the left hemisphere. For over 100 years, the research in the area of neurolinguistics was completely dependent on the study of comprehension processes and the production of people, language comprehension and production of people with aphasia. So, what is aphasia like? The question can be that is losing of a language due to some damage in brain also results in the reverse of learning this language or not? Can you see that it leads to a reverse in learning of a language as well? Now, using language also involves other knowledge and skills. It has been seen that people who suffer from aphasia, in some cases, they are still able to do certain things. Then there are certain cases or certain things that they can do clumsily, and there are certain things that they cannot do at all. So shift has been in the area of neurolinguistics, and it has been seen since 1990s with the advancement of or introduction of technology in this area. Now, any activity in the brain can be tracked down, and that has been made possible with the advancement of the technologies in this particular area. So the shift is not to just look at the comprehension and production of people with aphasia, but also see that how brain processes, especially in the case of normal speaker, processes the language, and how a damaged brain processes the language or compensates for injury. So this activity can be tracked down. You can look at it in terms of when people are speaking, reading, or listening, and how it can be done is, or how the damaged area of the brain sort of gets engaged in the process of any activity. You can track it down and also have a fine spatial resolution of the locations of damaged areas in the brain with the help of magnetic resonance imaging, which is MRI, and also CT scans. So the shift is not only to look at just the comprehension and production of people with aphasia, language production of people with aphasia, but also the shift is to have a clear-cut view of things that takes place in the brain. So there is the shift integrates and involves the neurologist, neurolinguists, surgeons, and so on. Now, with the help of that, it has become easy to detect and examine the language processes that takes place in the case of people suffering from aphasia. The most common cause of aphasia is a cerebral vascular accident, that is CVA, commonly referred to as a stroke. But brain damage following traumatic head injury such as road accidents or gunshot wounds can also cause aphasia. Aphasia following such traumatic events is non-progressive in contrast to aphasia arising from brain tumor, some types of infection or language disturbances in progressive conditions such as Alzheimer's disease, where the language disturbance increases as the disease progresses. Diagnosis of primary progressive aphasia as opposed to non-progressive aphasia, which is the main focus of the neurolinguist, It is based on the following inclusion and exclusion criteria by M. Marshall Museum. M. Marshall Museum in 2001. Inclusion criteria are difficulty with language that interferes with activities of daily living, and aphasia is the most prominent symptom. Exclusion criteria are other non-generative disease or medical disorder, psychiatric diagnosis, episodic memory, visual memory, and visuo-perceptual impairment, and finally initial behavior disturbance. These are two criteria that have been proposed. Then we have aphasia, which involves one or more of the building blocks of language: phonemes, morphology, lexis, syntax, and semantics, and the deficits occur in various cluster or pattern across the spectrum. Now, the degree of impairment varies across modalities, with written language often but not always more affected than the spoken language. In some cases, understanding of language is relatively preserved. In other, both production and understanding both are affected. At the most severe end of spectrum, a person with aphasia may be unable to communicate by either speech or writing and may be able to understand virtually nothing or only very limited social greetings. At the least severe end of the spectrum, the aphasic speaker may experience occasional word-finding difficulties, often difficulties which involve nouns. To sum up, despite great variations in the condition pattern of language, deficits associated with different areas of brain damage have been influential in understanding language-brain relationship, which is called neurolinguistics.